Hello, this is Luis Ramirez Cajas, and this is my Module 7 assignment, the Holistic Assessment of an Older Adult. Today's objectives will be to perform a holistic health assessment on an older adult, interpret abnormalities discovered from the holistic health assessment of the older adult, develop a teaching plan to address abnormalities discovered during the holistic assessment of the older adult. Holistic health assessment of the older adult. General health history. First, we will meet our older adult. We have a 73-year-old Hispanic American female. She shares with us a medical history and diagnosis, history of hypertension, congestive heart failure, and asthma. Past surgical history includes a cholecystectomy, but no other surgery was reported. Family medical history includes father with cardiac disease, death from a heart attack, mother with no history but died of colon cancer. For her social history, includes no tobacco use or history of, no use of alcohol, and no use of illicit drugs or history of. Her daily medications include amlodipine 5 milligrams daily for hypertension, albuterol rescue inhaler 90 micrograms as needed 2 puffs, and aspirin 81 milligrams daily. She denies any medication allergies. Our physiological assessment includes reviewing her cardiovascular and pulmonary systems. The older adult reports occasional issues controlling her blood pressure, dyspnea on exertion, and needing to stop and to apply her home oxygen when she experiences a dyspnea on exertion. Renal and genital urinary systems. OA reports nocturia. Oropharyngeal and gastrointestinal systems. OA reports occasional sinus issues, seasonal allergies. We continue with the musculoskeletal and integumentary systems. The OA reports bilateral knee pain with ambulation and descending stairs. Nervous, endocrine, and sensory systems. Our older adult reports using reading glasses but denies any other dysfunction. Hematopoietic and reproductive systems. OA denied any dysfunction. First, we begin with our cognitive assessment of the OA. Our OA's cognitive function evaluated was using the mini mental state examination. Her orientation, she was oriented to person, time, place, and situation. Registration, our OA was able to recall 3 objects named by the examiner. Attention and calculation, able to recite the Spanish word tierra backwards. Recall, our OA unable to recall one of the 3 objects named at the commencement of the MMSE. Language, our OA was read and following written direction, which were close your eyes. Copying, OA able to copy a pair of intersecting shapes. Psychological assessment. Psychological assessment is a complex process that involves the use of good communication skills, appropriate interview questions, and purposeful observations. An assessment of mental status involves an assessment of all of the following. Physical appearance, our OA appeared well kempt, appropriate for dress for the season. Her motor function, she ambulates well but short distance without assistance. Social skills, she reports socializing in church. Response to the interview, it was appropriate. Orientation, she was oriented times 4. Alertness and attention, she was alert and oriented, attention adequate. Memory, it describes some memory issues but mostly intact. Speech characteristics, the OA's speech was adequate and appropriate for conversation. And mood, the OA reports feeling depressed and lonely, but appeared in an okay mood. Social assessment. Social reports can be categorized as formal and informal. Informal social supports include friends, family, clergy, neighbors, or co-workers. Formal social supports include workers who are paid by the older adult, their family, or by health and social service agencies or institutions. Nursing assessments of social supports identifies not only the resources that are needed, available, or being used to support the highest level of functioning, but also the barriers to use of appropriate resources. So it clearly identifies what people must overcome. The OA, as far as our OA, she had informal supports, which include 2 daughters, 4 sons, some church friends, clergy. Well, formal supports included her doctor's clinic, medical transfer services, social services. Cultural assessment. Cultural assessment included assessing the OA's ethnic background, religious preference, family patterns, food preferences, eating patterns, and health practices. The OA revealed the ethnic background from Guatemala. The OA revealed the religious background of Pentecostal Christian. The OA revealed family patterns that include an alcoholic son who passed away in 2015. The OA revealed food preferences that admittedly are high in fat, carbohydrates, and sodium. The OA revealed eating patterns of 2 meals a day with small snacks in between. And the OA admits to health practices of taking daily medications, self-monitoring blood pressure, and controlling asthma symptoms. Developmental assessment. According to Erickson's stages of psychosocial development, this OA would be in the stage 8, older adult stage, integrity versus despair. The OA reveals she has minimal regrets regarding not completing secondary schooling, but overall feels accomplished that she was able to buy her home and provide opportunities for her children. Spiritual assessment. In health and social care provision, spiritual care aims to respond to the needs of the human spirit and provide meaning during times of trauma and sadness. This response could come through one's faith or through discussion with a sensitive listener. In the context of illness, spiritual care may be necessary to support recovery and explore concerns about death and dying, religious and non-religious convictions, rituals and practices, relationships of significance, and a sense of the sacred and beliefs. The OA identified a strong Christian faith and identified depending on her faith when times are tough, as when her son passed away, when her other children became ill with the COVID-19 virus. The OA reported that she is not afraid to die as she is at peace spiritually and believes she will go to heaven in accordance with her faith. Interpretation of abnormal assessment findings. Impact on the OA's life. The OA reported an abnormal finding of becoming short of breath occasionally after mild exertion, such as going up the long stairwell in her home that leads to the second floor. The most likely cause for this would be a combination of uncontrolled blood pressure and worsening congestive heart failure. This abnormality impacts the OA's life by limiting her activity daily, limiting the amount of exercise she can tolerate, which places her at higher risk for falls or syncopal events. Having her activity limited also adds some of the depression that the OA reported. Stress, coping, and recommendations. The OA reports feeling stressed and depressed at times as her activity is limited and she often feels fatigued. The OA reports decreased ability to fall asleep and also staying asleep with increased use of home oxygen for the past 2 to 3 months. The older adult appears to be coping overall with some home health visits arranged by her primary care provider. Recommendations would include making follow-up appointments with one primary care provider for reevaluation of orthopnea, near syncope, increased oxygen demands. Mental health providers for evaluation of depressive signs and symptoms with possible treatment through psychotherapy, medication regimens, complementary therapies such as yoga, exercise, dietary changes, or even electroconvulsive therapy. Social work to ensure that the OA is receiving oxygen supplies on a timely basis and to possibly explore options such as portable oxygen device which would allow less of a limit on the OA's activities. Nurse teaching plan, physical goal and teaching strategy. We will be implementing an ambulation goal of walking for 15 minutes, resting for 15, and then another 15 minutes of ambulation 3 days out of each week. Evaluation and implementation would involve complementary therapy such as physical therapy and occupational therapy to evaluate the patient's ambulatory gait and balance. Once satisfied that the OA can ambulate safely, the teach-back method will be implemented as home health can continue to evaluate the OA on a weekly basis along with having the OA keep a journal of how her ambulation goes while at home. After a determined period, the OA should be reassessed for improvement and or necessary adjustments. Psychological goal and teaching strategy. The OA identified a psychological goal of acknowledging her feelings and emotions as she confessed that she feels that she just shuts them out. The teaching plan would include professional counseling in order for the patient to explore and address her feelings and emotions on this matter. Journal keeping would also be encouraged in this matter. Social goal and teaching strategy. The social goal identified by the OA is to be part of at least one social function per month, and once activity tolerance increases, attend 2 social functions per month. The teaching strategy used would be journaling, group therapy, and discussing the OA's mental state relating to this. Developmental goal and teaching strategy. OA identified exploring her feelings of accomplishments and her thoughts on those goals that she didn't accomplish in her lifetime. Discussion on these thoughts and feelings will be used to explore ways that the OA can feel more accomplished, such as taking courses online or at the local community college to further the OA's education. Spiritual goal and teaching strategy. The OA was unable to differentiate and separate her religious faith and spirituality, and there invokes both as one and the same. The OA identified as going to church events more often and spending more time praying throughout the week as a spiritual goal, with simple counseling discussion as a teaching strategy. Evaluation plan. Evaluation of the teaching plan will be performed periodically with the cooperation of complementary therapies such as home health professionals, social work, counselors. The most comfortable communication modality will be used as possible when reassessing the interventions put in place, whether it's via telephone, telemedicine, or personal home visits. Thank you very much. Here's my references.